Dr. Samantha Yammine is a science communicator with a PhD in cell and molecular biology and neuroscience, better known as Science Sam. She's passionate about empowering people to explore science by making it more familiar, accessible, and inclusive. Throughout the COVID-19 pandemic, she's been sharing the science behind the headlines as Science Sam on Instagram and TikTok, garnering millions of views every month to better help people assess risk, spot misinformation, and have informed discussions with friends and family. She's hosted a live stream with an astronaut above the International Space Station, presented her research on the streets of Toronto's busiest intersection, and talked ringside with Muay Thai fighters about performance anxiety. She's also been a guest science correspondent for a variety of shows on Netflix, TVO Kids, CBC Gem, and ASAP Science. And she's on the advisory board for the anti-misinformation organization Science Up First, and the editorial board of the World Congress of Science and Factual Producers. We've welcomed her back today as one of our most popular webinar guests to help us understand how this current stage of the pandemic may impact our lives and insight on how to manage through it all. Welcome, Sam.
Hi, everyone. Thanks so much for having me back.
It's very good to have you. And so our structure today, I'm happy to start it off with a few questions that I understand you'll answer a bit more in depth off the top, Sam, and then we'll have a conversation and I'll bring up questions that come up from the audience, if that sounds good.
Sounds great. Can't wait.
Good, great. So off the top, I think it would be helpful if you could just share insight about the approach you'll be taking today and kind of the lens through which you look at the world.
Yeah, thank you. I always want to be really clear with people what my expertise is and what it isn't, because I encourage you also to always think that of any source, anyone who you're receiving information from. It's always really important to put it into context what they're saying with what their expertise is, and are they sharing their opinion or are they sharing a consensus? So my expertise, my training, my PhD was all in cell and molecular biology, really specializing in cells of the brain. Through that training, I learned how to read the scientific literature, assess information critically, and it's also helped me connect with a network of experts. And so in my role now as a science communicator, I'm kind of like the middle person, the liaison between the people with specific subject expertise and everyone who may not have scientific training. So what I'll be sharing with you today, unless I say that it's my opinion, it will be based on the consensus of what experts have been saying, their interpretations of the literature, and my review of all of that. And I'll always be referring to consensus because it's really, really important to science. It's not what one person thinks, it's what a large body of experts concludes through the scientific method. So I'm playing the role of communicator here, that liaison between those experts and you to try to make it a little easier to navigate.
Thank you. Yes, we appreciate that. And I would also remark that while you've been so vocal and so helpful to so many with the insights and sharing this information, I know things change on a daily basis, and part of the great timing of today's session is that some things have changed as of yesterday. And just to clarify, there's no expectation that you're like up to the minute about the data and the research or what's happening in every province, but we appreciate what we know you do know. So thank you.
Yeah, I appreciate that. I try my best, but also a good flag. Anyone who pretends that they're keeping up with everything, that's a red flag because it is impossible at this state. Even people whose job it is to keep up, there's always something new. So that's a great point. This is current as of right now to the best of our knowledge.
Excellent, thank you. Well, and so touching on the timing for today, we've seen the lifting of some of the passport mandates as of yesterday and lifting of some restrictions. Can you share with us what you see that means and exactly what is happening?
Yeah, I wanted to do a quick check-in on there have been a lot of changes this week in particular across Canada. I saw that Saskatchewan dropped its COVID health protections on Monday, including requirement to wear a mask. Alberta lifting almost all of its remaining protections Tuesday. PEI discontinued their Vax Pass Monday. Nova Scotia lifting its protections March 21st. And BC seems to be keeping it's lifting a lot of, I guess, the capacity limits and things, but they're still using masks and vaccine cards. And they're saying it's supposed to stay in place until the end of June. And where I'm based in Ontario, yesterday, March 1st, was the first day where the proof of vaccination policy is being lifted. And I think we have no more capacity limits on things, but we still currently have our mask mandate, although there's talks of lifting that, which is quite concerning to me. So I think what we're seeing right now is a change. And it's definitely a moment in time where individuals may want to reassess some activities that they do and don't do, maybe the timing of those. I want to emphasize it's never a binary decision. You don't need to make a blanket statement like, I will not go to restaurants. It can be, I'll go to some restaurants depending on how busy they are or depending on what else I'm doing that week. So I want to emphasize the point of our discussion today is to think about a harm reduction approach in the personal decisions that we make. And then for those who are decision makers in the corporate world, just because these changes are happening at the provincial level, you may still want to keep your own policies in place. And I want to get into how you might go about thinking about that. I can't give, specific advice for your company, but at least get the conversation started on some of the variables to think about when making those decisions.
Thank you for that. And perhaps we'll take the geography one step further. And can you share a bit about how you see what we're doing in Canada compared to some other places in the world, including the US? We have some attendees from around the world, and not to cover the whole globe, but context.
Yeah. Well, we'll be here a while, and I'd have to look some up. But so in the US, the CDC, I think it was last Friday, which it kills me when they release things on a Friday afternoon. Give us a break, going into the weekend. But they released something that was misinterpreted. It's their new mask guidelines. And they want to basically qualify mask mandates relative to the local epidemiology. So they defined low, medium, and high risk. And they were defining, if it's a low risk time in your region, maybe you don't have to wear a mask in indoor public settings like a grocery store. That's been largely misinterpreted to thinking like they're throwing out masks or they're recommending throwing out masks. They're not. I think they're trying to talk more about risk assessment to let people have the tools to think things through and to get breaks when we can take them. Really, it's about let's take advantage of breaks because this isn't ending soon. So we need to work on our stamina here. Unfortunately, many places have dropped masks and even taken things further and are trying to not allow masks in the US. I will say I was looking up the policies in France because we're thinking of maybe doing some travel there at some point this year. And I was really envious because they not only are keeping their proof of vaccination system, which is all really easy to verify through an app, harder to fraud from my understanding of how it works. And it also includes boosters, which I wish we were doing, and I'm a little jealous. So I just want to say, what's happening here in Canada and the UK, I think, is quite similar to what's happening in US and Canada. That's happening in those regions, but there are other places that are still keeping lots of protections in place. And I think we can all make predictions on how that's going to go.
Okay, yes, thank you for putting that into context. And so I'll pick up on your last comment that we all may know how that's going to go. Can you talk about the numbers and how are we doing at this stage?
Yeah, fortunately, the Omicron wave, as I'm sure we've all felt, it was a big one. We had a ton of cases. Our high vaccination rates across Canada, really, and in multiple states in the US and the UK, I think it's really helped us and helped to minimize the deaths, which is great. So even though we had a ton of cases, we didn't see on a per case basis as many deaths as we had in previous waves, which is a good thing. And again, the point of vaccinations. The challenging thing was because there was so many cases, we had a lot of hospitalizations, and it definitely overwhelmed our systems here. A lot of my friends are clinicians working in hospitals, and it was a really challenging time for them. being redeployed to different wards and all that. So I just want to emphasize, a lot of people were saying, oh yeah, but it's so mild. Well, maybe on an individual basis for some, but on a population basis, it was not mild. And it was a lot to deal with. Fortunately, we are coming out of that wave now. We can see we have reduced testing, so it's a lot harder to look at the testing and try to guess exactly how things are going. That's a big challenge here in places that don't have wide testing. How do you know how things are going? Because can you really, like, are the testing, are the case numbers really representative? So scientists are using things like wastewater surveillance, which is where they look at the level of the COVID virus in wastewater, and they can test that and see how it changes over time. And it's really, really cool. It lets you get like a population readout. So you can see relatively to in December, things are coming down in most regions and overall. So that's a good signal. With the changes this week, we're anticipating some kind of bump. You know, it's not going to continue going down. Whenever there's a change, there are going to be more cases. And so we'll have to keep an eye on the impact that will have on our hospitals, on people, on workplaces. So I just want people to know, like, whenever there's a change in policies, we anticipate a bump. So things are in a good direction. That could change slightly. It happened last year as well. And I think that just is good notice for people to go slow and just be mindful that maybe they're not getting all the information from cases alone, but if you're vaccinated and boosted, you have good protection. So take things at a pace that feels right.
Great, thank you. And that makes me think of the mindset of just because you can, does it mean you should? And do you have thoughts about that in terms of how some of the guidelines are changing and the reaction by people?
Yeah, I think policy is a beast, right? They're factoring in the science. I mean, hopefully in some places, we want them to be factoring the science, but there are obviously other layers that go into making a policy decision. So I want people to realize that what the rules aren't necessarily what's the best. And also, it might be different for you in your specific situation. If you have someone pregnant at home, that makes them higher risk. If you have young unvaccinated children, well, it tends to not be so bad in kids. It doesn't mean that there's zero risk. And so you may want to make decisions differently than someone who, for example, is young with no prior conditions and lives alone. So we always have to be factoring in, like, just because we can doesn't mean we should, as you said. And even then, what one person should do versus you could always be different depending on that context. So we're factoring in our community levels. We're kind of thinking of these different layers. What's going on in my community? And then what are the risks in my household? And what do I have coming up? You know, maybe if I'm going to go visit, for me, if I'm visiting my parents on the weekend and they're a little more vulnerable, even though they're fully vaccinated, maybe I don't want to go to a restaurant the night before or 2 days before, because I know that that's kind of the window where I could be infectious and not detecting it by rapid test. So we just think about it like that. Maybe I'll save my restaurant outings for Sunday after I've seen my parents, and kind of modify behaviors like that, if that makes sense.
Great, thank you. And you touched on considering travel coming up, and I know there'll be a number of people looking at travel or have made travel plans for March break, which isn't that far away. Any suggestions there specific to travel?
Yeah, again, it comes down to your family's risks and level of protection, risk tolerance as well. And I think choosing a place that has some protective measures in place, places that are requiring travelers to be fully vaccinated, going to resorts that may be using masks when people are walking around. That's what we've been looking for. We've been trying to find places where we're going to feel safe in the airport as well. Like, is there a mask mandate at the airport where we're arriving? Right now, I feel pretty safe getting on a plane in Canada because we have the vaccination policy and we have mask mandates here, in at least where I'd be taking off from. So I feel good about that. If those things change, my attitude towards travel may change. I would say, yeah, just paying attention to those details, where I'm arriving, the plane itself has a high filtration rate of air. There's lots of air exchanges on a plane. That's always been the case. So I'm not so worried about my time on the plane, unless someone's sitting right next to me. That could be a risk. But overall, with the number of people in that area, I think it's a bit of a safer environment because there's a high ventilation rate on planes. So I'm still at risk from people immediately next to me, but less at risk from the other people in the plane because of that ventilation. But the airports can be crowded. So you want to make sure that, you know, there's masks in place there to try to keep that protection. So it's not easy. Travel is complicated enough, especially with kids. So I know that it's annoying that I'm suggesting now looking in these additional things. And I'm with you. We spent all of last night reading about vaccination policies and passes in the EU, and it's not fun. It's not easy, but I think there's also always a risk in travel. What we've been thinking about is, well, if I have to test to come back, and I did test positive and I have to go in a hotel quarantine, would I be comfortable with that? Can I afford that? If something happened and I was stuck in my hotel room, am I comfortable with the hotel I'm staying at? Like, it's just these extra layers to consider. I think it doesn't mean you can't do it. It just means make sure you've thought them through and they make sense for your family.
Thank you. And hopefully that addresses a good portion of one of the audience questions here, which was about traveling into the US in about 2 weeks. And I think the question centers around how confident can you be if you're triple vaccinated? So they're still hesitant, especially based on how some states have handled things in the US, and wondering if any hesitation is justified since they're double vaccinated and boosted, or is it the same as being in a big city in Canada like Toronto?
Yeah, that's a great question. I will say being double vaccinated and boosted, or being double vaccinated and having recovered recently from a COVID infection, you have pretty good protection. Omicron is, I like to call it sneakier at getting past our first layers of immune defense. So I want to be clear, vaccines aren't useless, they still work, and they still protect against severe outcomes from Omicron, including hospitalization. And from some early studies, the rate of long COVID, which I want people to remember is a real and scary risk that we need to be worrying about, even though we don't see stats on it all the time. We're not worrying, but we need to factor in. So being fully vaccinated, 2 doses, if you got it back in the summer when most people did, and then you were recently boosted, you have pretty good, I don't know the exact number because we're still getting that data. We're still looking at the time course of how long the protection lasts. But that recent booster or that recent COVID infection means that your primary layers of defense, those antibodies that are circulating, they're at higher levels than before your booster. And while Omicron is sneakier at getting past those first few layers of defense, you have more of them because of your recent immunity. So whether from vaccination or infection. So it's kind of like you could still get infected, but the likelihood of you having symptoms that last very long or lead to complications is a lot lower. So your personal protections are quite high if you're recently boosted or recently recovered from an infection after your first 2 doses. You're in a good spot personally. You still could test positive, and so that could have implications for your travel. It could delay things. It could mean you have to stay in a hotel there a little longer, but your recovery should be pretty quick. And it shouldn't be too bad. So that's a helpful thing. I think if you're going to travel after you've just had a boost to your immune system from infection or from vaccination, I think that's a good time to do it. But in choosing where to go, you want to optimize your chance of success, right? So I would be hesitant to go to a place where I know that they're a little more nonchalant about COVID protections, a place that's completely thrown out masks, or a place that never had a vaccination policy, or in general has low levels of community vaccination rates. I'd be hesitant to go somewhere like that personally. If you have family there and you have a really good reason to go and you think you can mitigate your risks while you're there, then it might be different for you. But I don't have family that lives anywhere in those So I'm less motivated to go. Going somewhere like California, where we could spend a lot of time outside and they have higher vaccination rates, I would feel a little more comfortable with personally. I know, it's a long one because there's so many layers. Thanks for your patience.
Well, I think there'll be something in there for everyone, so that's good. There is a question about wearing masks, and you've expressed some concern about kind of the openness about wearing masks or not. So specifically, Kathy's asking, I've read that physicians recommend wearing a mask until your specific community cases are lower than 10 to 15 per 100,000 as their own rule of thumb before physicians plan to go maskless. Can you share your thoughts on that?
Yeah, that's a really great. I think we're at the stage where we need those kinds of benchmarks. I think our policymakers are doing benchmarks in terms of time, like end of March, end of June. And really what makes more sense is to do it in terms of the epidemiology. So I really love that you brought in this specific number. I don't have a specific number in mind. That sounds reasonable to me, with the caveat that when we have many barriers to testing, those exact numbers mean a little bit less. So that's where I struggle with knowing the exact number, because when we have way less testing, you still have lots of virus circulating, but we're not detecting it. That definitely happened in December and January with the Omicron wave. So indicators that I was looking at were percent positivity. Of those who are actually getting tested, what percent end up being positive? Right now it's 10% across Canada. That's pretty high. Usually we try to aim for much lower. With vaccines, we can have a little, like, it's not as bad as 10% would have been before vaccines, but still, it's still quite high. And so I personally would want to see things stabilize a lot more before I would feel comfortable going maskless at a grocery store. I also think it's quite easy to wear a mask. It's not like, it's obviously better to not wear one. I don't love wearing a mask, but at a grocery store to wear a mask, it doesn't hurt the experience too much. So I would rather just keep doing that and then save my risk budget, as I call it, for settings where it's more meaningful to not wear a mask, like a restaurant, like a get together with family. So that's where I kind of stand. I don't see myself not wearing a mask in public settings like a grocery store or shop for the foreseeable future.
Thank you. And as part of that, you touched on the changes in testing, and there is a question about, can you comment on how the landscape for COVID testing changed since December with access to rapid tests, and can the COVID case counts really be accurate these days?
I don't think we can interpret test numbers or case numbers the way that we used to. I think there was a stage last summer to fall where it was very easy to get tested, at least where I live, and I think in many places across Canada and in the US, you know, with some always limitations and caveats, but it was relatively easy to get tested. So case numbers were more informative, at least to track where we were in a wave. With high vaccination rates, I wasn't as concerned about high case numbers because at least we had high community protection. Now we're at a stage where not everyone's boosted, so there's not as much of strong immunity. We don't have as much testing. It's kind of hard to interpret those raw case numbers. So I agree with this question. Like, really, you have to take a few things into consideration, which is annoying and more challenging. But looking at that percent positivity, 10% uncomfortable. I would like to see that go down. Looking at the wastewater surveillance, are we past the peak? It looks like we are in Ontario and in Canada. Whether that's going to go up a little bit in the next few weeks, we'll keep watching. So I would look at those things in combination. And I would also caution people that some of the policies coming out are really just looking at hospital metrics. And that's challenging because that always lags. So we definitely, when the hospitals are in bad shape, you don't want to be taking unnecessary risks because that puts everything at higher risk. But just looking at hospitals to determine what you do can leave you a few weeks behind.
Got it. I'm going to squeeze in as many as we can before the end. You referenced in your opening about businesses, and we've seen more businesses encouraging employees to come back to work or outlining specific days. Can you share your thoughts in general about people going back into the office and workplaces?
I think it's great if I think it's great to start considering it. I think if there was any time, I think going into the warmer months is always the best time to consider it. I would be flexible knowing that it may have to change again and be really swift. The advice from Mike Ryan at the WHO is always be swift but imperfect. Don't strive for perfection, do the best you can and be ready to be nimble with it. Things that you can do as an employer, I still think there's huge value in having a proof of vaccination policy because that protects your workers and it protects their families as well. Even if it's just 2 doses, that's at least showing that your workers have a reduced risk of severe outcomes. Boosted is better because now you have the transmission protection too, to some extent. But there are people in your workplace who are immunocompromised or who live with someone immunocompromised, and having those measures in place is not only going to be better for their health, but for their mental health too, and their comfort in work, their actual safety. And then also it's showing, that you care about the stress they'd have to go through if they were sick or someone they love was sick. So I would still say, consider keeping that in place. And if there are things that you can do, like wearing masks when it's easy to at the desk, and having air purifiers or an updated HVAC system for improved ventilation, that's great.
Thank you. And there's a question from Irene around, if you've tested positive, can you still test positive even 3 months later? And will that affect any of your testing?
Great question. I'll try to answer quickly. I know we're getting to time, but I want to point out that there's PCR testing and there's rapid testing or rapid antigen testing specifically. Those are the at-home tests. With PCR tests, it's very sensitive. It can detect like any viral genetic material, right? And it's very, very sensitive because there's an amplification step where it takes your sample and then it makes copies. So it can detect even low levels. That's the test that you can see people continuing to be positive on, even weeks, if not even few months after their infection, especially for folks who are immunocompromised or don't have any prior immunity. So PCR tests are where you might continue to test positive, but no longer be infectious. Rapid antigen tests, on the other hand, there's no copying done. It only detects what's like to certain levels of what's there. And so it's less sensitive of a test. Therefore, a positive on a rapid test, a rapid antigen test, the at-home test you can do yourself, is more likely to mean that you're infectious. Negative on those tests doesn't mean that you're not infectious. It doesn't mean that you couldn't transmit, but if you're positive, it's much more likely that you would transmit. So that test, you are unlikely to continue to be positive on months and weeks after. Typically, people test positive on a rapid antigen test for about a week. And then it starts to, like in the very beginning, early days, you tend to have a false negative. You won't test you won't test positive in the first few days of an infection, but you would still be infected. Then you'll be testing positive a few days, and then you typically will be clearing the infection, no longer testing positive on a rapid antigen. So depends on the type of test is the short answer.
Right. Well, and that helps because I know there's a lot of questions about the different types of tests. So I appreciate that.
Yeah.
And looking a bit more into the future, if you're able, there's questions from Nancy and another question about what this might look like for us into the fall. Will we see another variant that could evade vaccines? And she's referencing to a New York Times op-ed that the last wave during 1918 was so lethal because people let their guard down. So you have thoughts about that and maybe tying in. So do you think, for example, vaccine passports will come back at some point?
So I'm not gonna make predictions because they're just gonna be wrong. And anyone making bold predictions, I'm cautious against. But I would say I would not be. I think one thing we can feel certain is there will be more variants. We've been finding variants all throughout, and I don't see given that there is still not global vaccine equity, given that we still have many people around the world who haven't even received a single dose, even high-risk people, I think we can reasonably expect another variant of concern because there's still so many people vulnerable around the world. So I would say, you know, there will likely be another variant. Will it impact us as much as previous ones have? That's the question mark. That's the part we don't know. I think it's always reasonable to expect a lull in the warmer months when it's really easy to be outside. And I think it's reasonable to always see an increase, a wave around flu season when people tend to move indoors. So how big that wave will be, how much it will impact our lives, I don't know. I do think that assuming that anything could be perfectly normal this year is unrealistic. I think we can pretend it's normal, but actually things aren't going back to normal. They'd be worse if we ignore things. Learning to live with COVID means we learn. We learn these lessons, we implement what we can, and we still have a lot of fun. Like last year was pretty fun. We got to do a lot of things and we were safe doing those things. And that's really the goal here is let's take advantage when cases are low, when we're fully vaccinated and boosted and have high immunity. Let's do things, let's have fun, but let's also expect that things could change. And so we have to be prepared for that and we have to be swift. And that's the challenge that we've seen. I would love to see proof of vaccination policies come back when it makes sense. I think when we didn't have access to testing and our guidelines were saying that people didn't need to be boosted if they were recently infected, it was hard for them to implement a vaccine policy that made sense. So ideally, a vaccines policy include boosters or recent infection. And that's hard to implement when we weren't tracking recent infection. I think in a few months, anyone with recent infection will be recommended to be boosted. And at that point, I would love to see us move back to a vaccination policy. I'm not sure that we will, but I think it would make sense too. So we'll see. I agree not to let our guards down. We don't even need to look back to 1918. When we did that last fall, it happened again. So I think we can learn, we're living in history, and I think we can hopefully start to learn in real time, but I won't cross my fingers for that so much, but it's a lot on individuals, and I think we're all doing our best, and I appreciate everyone's efforts because it does make a difference.
Thank you. And certainly that's a key message. And also, you know, how you've pointed out about it's learning to live with COVID. And that's part of what you've been able to provide so many people with today is some of the mindset and concepts around what it takes to learn to live with it and see our way through it, supporting ourselves and each other. Thank you. Thank you so much, and you do it in a way that that truly is so accessible and warm. And I saw Courtney's comment pop up. Actually, she's watching this. A colleague came by and really appreciated your background and just providing a welcoming environment for everyone on the screen. So, thank you so much, and I'm glad we got most all of the questions answered as we move into this next phase in a way that is safe for as many as possible.
Thank you, Teresa. And thank you all for tuning in. I really appreciate it.
Thanks, Sam. And thanks to our audience. We will be back every 2 weeks with a new speaker on a personal or professional development topic. And we look forward to helping you with your speaker and event needs. Feel free to reach out anytime. Take care.